This article talks about clinical and radiographic outcome of regenerative endodontic procedure for traumatized permanent necrotic teeth with apical periodontitis and external root resorption. This article done by Jing Lu et al. In China in 2023 and published in International Endodontic Journal. As we know, pulp necrosis of teeth is a common sequela to traumatic injury, and the external infected root resorption is associated with the pulp necrosis and a fulgent injury of mature teeth if the pulp is not extirpated within 1 to 2 weeks of injury. And it is expected that the teeth with pulp necrosis and external inflammatory root resorption should respond well to treatment with the regenerative endodontic procedure, as there is a stringent disinfection of canal required prior to inducing a blood clot or introducing a scaffold into pulp canal space. So the aim of this study was to describe the clinical response of traumatized teeth that were diagnosed with pulp necrosis, apical periodontitis or abscess, and external root resorption, either inflammatory or replacement. And another aim of this study is a quantitative assessment of potential increase in the radiographic root area by measurement of any deposition of calcified material in the root canal walls to allow the analysis changes in the root dimension following a regenerative procedure, as described by Fleck in 2014. In this study, 16 patients with 20 traumatized permanent incisor teeth diagnosed with pulp necrosis and external root resorption were involved in this study, and details of history of trauma and treatment after trauma was obtained for all the patients, and all the details regarding the clinical examination and radiographic examination were also obtained. And the regenerative endodontic procedure were performed by single operator according to the recommendation of AAE 2021 and ESE 2016 guidelines. In the treatment, they use calcium hydroxide as intracanal medicament, and all the patients were reviewed clinically and radiographically post-treatment at 1 month, 6 months, 1 year, 2 years, up to 5 years. And the definition of treatment outcome, failure was defined as the presence of clinical sign and symptom after regenerative endodontic procedure, or persistence of a preapical lesion, or progressing of resorption. Success was represent successful cases without previously mentioned failure index or replacement resorption. And there is an evidence of a continued root development and regaining of pulp vitality. And the survival was defined as the tooth remain present in the arch throughout the study period. From the 20 teeth, 17 are immature teeth and 3 are mature teeth. And regarding the type of trauma, a fulgent demonstrates the highest rate, about 70%, and 5 teeth reveal a metallic sound, which indicate external replacement resorption, and were analyzed separately for changes in the radiographic root area after regenerative endodontic procedure. Regarding to the treatment outcome, all 20 teeth were survived after an average follow-up period of 3 years, and 14 teeth, account for 70%, were classified as success, and 1 tooth, which is 5%, classified as a failed due to the reoccurrence of inflammatory root resorption, and 9 teeth were sensitive to the cold test, and 10 teeth will respond to the electrical pulp test. And for radiographic examination, all the 20 teeth show a complete repair of a preapical lesion, and 70% show arrested resorption with intact periodontal ligament surrounding the root, and 5 teeth show arrested external inflammatory root resorption, which followed by replacement root resorption, which indicate development of ankylosis after regenerative endodontic procedure. and 65% appear to have a calcified tissue formed in the root canal space, and 41, which is 7 teeth of immature teeth, show a continual root development. Radiographically, according to the type of a trauma and extraoral time, the radiographic root area increase show a significant difference in non-aphylogeny group, and the aphylogeny group with the extraoral time less than 60 minutes, while the root or radiographic root area increase was not statistically significant in aphylogeny group of extraoral time more than 16 minutes. Within the limitation of this study, regenerative endodontic procedure, a biological-based therapy presents a reliable treatment outcome in traumatized permanent necrotic teeth with apical periodontitis and external inflammatory resorption in terms of healing of apical periodontitis and an increase in the radiographic root area measurement. And for the severe injury, especially at avulsive teeth with extended dry time more than 60 minutes, when the replacement resorption is expected, regenerative endodontic procedure may offer a preferable outcome than non-biological treatment, as this study indicates that external replacement resorption appear not to be inevitable with any growth of vital tissue in the canal.